Hey y'all, it's Dr. Tiffany. Hope you're doing well. So this is part two of how to survive when the Arctic somehow finds its way down into inappropriate places like Louisiana. And because, this part concerns if you're traveling or if you are outdoors and you have to be outdoors, okay? Um, because sometimes we can't always choose to just stay inside snugly and warm, okay? So if you do have to go outside, if you know you're going to be going outside, if you're not already out there, layer your clothing as well as you can, okay? That means, undershirt, t-shirt, sweater, and then coat. Do have a head covering. It makes a big difference, actually. And another way to keep the wind off of your nose and mouth is with a mask. So that's actually cheap but fairly effective, actually. Gloves and warm socks as well as appropriate footwear if you're going to be walking and it's snowy or something like that. Wear boots that aren't going to soak through. Don't drink alcohol to stay warm if you're outside, because it brings blood. It dilates blood vessels in your skin and brings your blood closer to the surface, so you can actually accelerate hypothermia that way. Never get wet, ever. That's like death in cold weather. So, and in your car, have things like blankets and along with help summoning equipment, which is, like a flashlight and flares or a reflective vest or something like that. And if you do get stranded, call for help immediately, okay? You know, um, don't call and text or whatever, just do that to save your batteries, but call for help immediately. If you're anywhere near civilization, and you have the means to do so, if it's during the daytime and you can safely walk to it, it's uncomfortable, but it may be worth it. If you do get frostbite, go to the ER for that, okay? If you do have, that's going to be, cold, numb fingers, toes, nose, ears. They'll usually look kind of grayish or whitish. And when it starts warming up, it's going to hurt a whole lot. So do get help for that, okay? And also consume things that are hot, like hot beverages and stuff like that. It's a better tool than you think. We don't have to do this often. You just have to make it through about 3 or 4 days. Love you. Stay safe.